How to identify the Vata dominant disease? What are the different parameters of Vata type of the disease? This is the topic of discussion in this particular video. Dear ANA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching the right information at the right time for the right purpose. When you think about the Vata dominant disease, in the sense there will be the unpredictable nature that may be observed in terms of the exposure of Nidana, in terms of the exposure of the, what do you say, that the degree of Nidana, in terms of the clinical manifestation, so there will be unpredictability. So this is the topic of discussion in this particular video. What are the different parameters wherein we are going to observe the Vata Dosha vitiation in the body? So that is going to be discussed here. When you think about the Vata dominant disease, initially we are going to see in terms of the Mahabhuta as such. In the sense, when an individual is exposed to the Vayu and Akasha Mahabhuta, dominant etiological factors, there may be the possibility of vitiation of Vata dosha in the body. When you think in terms of the rasa, Katutikta Kashaya rasa will be responsible for the vitiation of Vata dosha. In terms of the guna, Ruksha, Laghu, Shita, Khara, Sukshma, etc. So there will be the vitiation of Vata dosha there. In terms of vipaka, usually the Khatu vipaka substances intake that will be leading to Vata dosha vitiation. In terms of the virya, Shita virya substances intake that will be leading to Vata dosha vitiation. In terms of the prakopa karma, we are going to analyze Sramsa Vyasa Vyadhaswapa, etc. We are going to see, then we may say that the person is having Vata dosha vitiation. In terms of the presence of Lakshana, Karshya, what we can say the emaciation, Karshya, blackish discoloration, Ushna Kamitva, that is the feeling of the desire of warm substances, etc. So that will be indicative of Vata dominance in the body. Sthana analysis. When you think about the locations of the Vata dosha, Pakvashaya, Kati, Sakti, Shrotra, Asti, etc. So that is indicative of Vata dosha dominance in the body, abnormal vitiation in the body. In that way, in terms of the Udbhavasthana, Pakvashaya is considered to be the Udbhavasthana as such. Whenever the person is suffering from the Nija Vikara of Vata dosha as such, Udbhavasthana of that particular Vata dominant disease will be Pakvashaya. In terms of the Samprapti as such, different categories of the Samprapti, that is the Vikalpa Samprapti, Pradhanya Samprapti, Bala Samprapti, and Kala Samprapti. Based on that, we are going to predict the possibility of a, what you say, that the Vata dosha vitiation. For example, the season, during the rainy season, so here Kala Samprapti, so that will be helpful. And in terms of the Nidana, source of the entry of the pathogen, which are the different sources of entry of the pathogen is going to take place in terms of the natural orifices. What are the different number of pathogens? Is it less or more? What about the virulence of the pathogen? Is it less virulent or more virulent? All these are going to decide the Vata dominance of the diseases as such. Coming to the each of these in detail, whenever if you speak about the Panchabhuta point of view, whenever a person is exposed to the Nidana, which actually leads to the increase of the Akasha and Vayu Mahabhuta. For example, the person is doing cycling, so wherein that too in the wind, fast wind, the time period, in that particular situation, that person will be having the abnormal increase of Akasha and Vayu in the body. Thereby, the person may be likely to have Vata dominant disease. In terms of the Shadrasa point of view, that is, the person who is exposed to excess consumption of either Katurasa or Tiktarasa or Kashaya Rasa, then there may be the possibility of abnormal increase of Vata dosha in the body. So that is Katurasa as such, that too, if the person is having the more consumption of the substances which are having the Vayu Mahabhuta rather than the Tejo Mahabhuta, there will be the abnormal increase of Vata dosha in the body. Further, Akasha as such, the Tikta Rasa substances, whatever may be the situation, there may be the abnormal vitiation of Vata dosha. Whereas when you think about the Kashaya Rasa, definitely, so the person who is having the consumption of the substances which are having the Vayu Mahabhuta dominance, then there may be the possibility of the, what do you say, that the abnormal vitiation of Vata dosha that is going to take place. This is about the Shadrasa point of view. Coming to the Guna point of view, it is even mentioned that Tatra Lukshu Raghushi Takara Sukshmashchalo Vanilah. These are the different properties of Vata dosha. Ruksha in the sense the dryness, Laghu in the sense the lightness, Shita coldness, Khara roughness, Sukshma minuteness, Chala that means the mobility or unstableness, Vishada that is clear. Whenever the person is having the exposure to these quality nidana, there may be the possibility of abnormal vitiation of Vata dosha there. So here one example let us keep. Most of these food substances are having the Ruksha Guna in them. Whenever a person is going to consume these substances in excess, naturally, so that will be leading to the increase of Ruksha Guna in the alimentary canal. That's how there will be more and more the influx of the fluid that is going to take place from the capillaries of the either stomach or small intestine, large intestine into the alimentary canal. Thus, this will be leading to the increase of the Ruksha Guna that is going to take place in the intravascular compartment. Let us take another example. So here, there will be the person is going to do the cycling, that too in the month of winter. In that particular situation, the abnormal increase of the Vata dosha is going to take place. Suppose if the person is not wearing the clothes which is covering the skin, then abnormal increase of Vata dosha will be observed in the skin. If he is not covering the ears, abnormal increase of Vata dosha may be observed in the ears. If he is not having the proper spectacles in the eyes, if he is not covering the nose as such, abnormal vitiation of Vata dosha is going to take place in the respiratory passages. If the person is doing the cycling for more than one's capacity, then the person will be having the breathing through the open mouth. Thereby, the abnormal vitiation of Vata dosha is going to take place in the oral cavity. In that way, the Nidana we are going to say, based on that, what particular guna of the particular dosha is going to get increased. Thereby, we are going to say there may be a possibility of a Vata dosha vitiation. So here, abnormal increase of a Shita guna is going to take place. Let us say the Vipaka as such. Whenever a person is going to consume the Ajamoda or Ajwain as such, so that is considered to be having the Katu Vipaka. If the person is going to consume more quantity of this particular substance, then there may be a possibility of abnormal vitiation of Vata dosha that is going to take place in the alimentary canal. When a person is going to consume ice cream, which is having the Shita Virya, then abnormal vitiation of Vata dosha is going to take place in the alimentary canal first. Then we are going to observe the abnormal vitiation of Vata dosha that may take place either later in the intravascular compartment and later in the interstitial compartment and later in the intracellular compartment. As far as the Prakopa Karma point of view, Vagbhata says, Sramsavyasa Vyadhaswapa Sadaruktoda Vedanam Sanganga Bhanga Sankocha Varta Harshana Tarshanam Kampaparushya Saushirya Shosha Spandana Veshtanam Stambah Kashayara Sata Varna Shagorlopeva Karmadi Vayoho. So here the abnormal increase of Vyasa type of the Prakupita karma is going to take place. Thereby, we are going to predict the prakopa of Vata dosha that is going to take place in the lower limb. As far as Lakshana are concerned, clinical features are concerned, Karshya Karshnyushna Kamitva Kampana Shakradgrahan Balanidriyendriya Bhramsha Pralapa Brahmadinata. Whenever if you observe any of these features, plus Lingam Shine Nile, plus the Kafe Brahma Shleshmashayanam Shunyatvam Rudrabhashtatasandita Kafakshaya Lakshana. If you are observing these, then we are going to say the person is having the abnormal vitiation of the Vata dosha in the body. So here this is one particular example where the Karshyata, emaciation, may be observed there, which indicates less nutrition, thereby emaciation. Sthana point of view. When you think about the Sthana point of view, it is being mentioned that Pakvashakati Sakti Shrotrasti Sparshan Indriyam Sthanam Vatase Tatra Pakwadhanam Visheshatah. The wise clinician has to interact with the individual regarding the dysfunction of the either Pakvashaya or Kati, that is the waist region, or thighs, Sakti, or skin, Sparshanendriya, Shrotra, that is the ears, Asthi, bones, Basti, urinary bladder, etc. etc. We have to inquire each and every organ dysfunction. Then, if at all, if you are observing 2 or 3 organ dysfunction, then that is indicative of a severe form of the Vata dosha vitiation. If you are observing the Vata dosha vitiation more than 5 or 6 organs, that is indicative of a much more severe dysfunction of a Vata dosha vitiation. If you are observing the only one organ dysfunction, that may indicate mild Vata dominant disease in an individual. As far as Utbhavasthana point of view, this is specifically applicable in terms of Nija Vikara, wherein the Udbhavasthana that will be definitely will be observed in the Pakvashaya. Hence, so whatever may be the situation, if the person is having the Pakvashaya affliction, then he is more likely to develop Vata dominant disease. Coming to the Samprapti point of view, so here, because of the time constraint, I am restricting to only Bala Samprapti only. In terms of the Nidana, depending upon the degree of Nidana Sevana, we are going to observe the dosha vitiation of Vata dosha. Degree of dosha vitiation may vary. Whenever if you think about the Shita Vata Sevana, this may vary in different individuals regarding the different time period. Suppose if the person is going to have the exposure only up to 5 minutes, then mild increase of Vata dosha that can be observed. If the person is going to have this Shita Vata Sevana exposure for up to 30 minutes, moderate increase of Vata dosha may be observed. If the individual is being exposed to 120 minutes or more, then that may indicate severe increase of the Vata dosha that can be observed. If the person is having the exposure for more than 4 or 5 hours, then that is indicative of very severe Vata dosha vitiation in the body. In that way, so the Bala Samprapti may be helpful in terms of the Nidana as such. Whereas Bala Samprapti in terms of the clinical features. Suppose an individual is having the cough. If this particular cough is being present for up to 5 minutes, then maybe a mild increase of Vata dosha may be observed. If dry cough is being present for more than 30 minutes, which may indicate moderate vitiation of Vata dosha in the body, and if the person is having the dry cough for whole night, that may indicate severe form of Vata dosha vitiation. In terms of upashaya, let us say the person is suffering from pain in the knee joint. If you are applying the oil and is getting the relief from the knee joint pain, so depending upon the degree, we may say regarding the mild increase, yeah, the severe increase of the Vata dosha in the body. For example, if the person is applying the oil and is getting the relief from the joint pain by 5 minutes, which may indicate mild increase of Vata dosha in the body. If the person is going to get relief from the pain after applying the oil for 15 minutes, that may indicate moderate vitiation of Vata dosha. If the person is going to have no relief after applying the oil, that may indicate severe form of Vata dosha vitiation in the body. In terms of the Nidana, so that is depending upon the source of entry of pathogen into the body, number of pathogens entering into the body, and virulence of pathogens entering into the body. So that is going to decide the degree of Vata dosha vitiation in the body. Let us learn this with one simple example. So here we are going to take the example of cycling in winter. So there may be the possibility of the exposure of entry of pathogens. So here the cold air that may be possible through the different orifices. Maybe in the mouth, nostrils, eyes, ears, etc. Depending upon that, there may be the abnormal symptoms may be observed depending upon the nature of exposure. Suppose if the Shita Vata is being exposed to the nostril, the symptoms may be related to the irritation to the nose may be observed first. If the person is having the exposure of Shita Vata to the eyes, he will be having the irritation to the eyes, etc. that may be observed first. And next aspect regarding the number of pathogens and virulence of the pathogens. So this is related to the degree of Shita Vata exposure. Suppose if the person is doing cycling for 5 minutes, that will be Vata dosha vitiation, that vitiation may be observed for a minor period. If the person is having this particular cycling for more than 30 minutes, the Vata dosha vitiation may be a little bit different. If the person is doing the cycling for more than 2 hours or 3 hours in this particular winter season, there may be the degree of Vata dosha vitiation may be a little bit severe there. In that way, the Nidana point of view, that's what we can say regarding the variability of the exposure of Shita Vata depending upon the quantity of cycling. So depending upon the what do you say that covering of the natural orifices, there will be Vata dosha vitiation that may vary. For example, on the first day, this particular individual has covered the ears, whereas on the third day, he did not cover the ear by the ear pods, etc. In the seventh day, he again does the cycling by not covering the ears. In that particular situation, the ear may be having the exposure to Shita Vata variably. Thereby, the Vata dosha vitiation may be observed in the ears in the varied vitiation pattern. So, even the Shita Vata exposure that may vary in the different diurnal basis also. In the winter season, the Shita Vata, the degree of Shita Vata will be much more in the morning, whereas Shita Vata degree that may be a little bit lesser in the afternoon. In that way, so the variability in terms of the frequency of exposure of Shita Vata variability in the exposure of Shita Vata to different natural orifices, variability in terms of variation of the Shita Vata on the diurnal basis. This may be the criteria to decide Vata Dosha initiation in the individual. To summarize, the Vata the dominant diseases, there may be the possibility of the exposure to the Akasha and Vayu Mahabhuta substances, exposure to the Nidana which are related to Katu, Tikta and Kashaya Rasa Atisevana, exposures which are related to the Nidana which increase Ruksha, Laghu, Shita, Khara, etc. Exposure to the Nidana which are having the Shita Virya and Katu Vipaka. By observing the Lakshanas where Kupita Karma of the Vata Dosha is seen, Sramsa, Vyasa, Vyadhas, Swapa, etc. etc. Observing the Lakshana of Kupita Karma of Vata Dosha, that is the Karshya Karshna Ushtakamitva Kampana Shakrit Grahan, Balanidrendriya Bhramsha Pralapa Bhramadinataha. Observing the Pakwashaya as the Utpavasthana is being observed, specifically in case of Nija Vikara. Then observing the locations of the Vata Dosha, that is Kati, Sakti, Shrotra, Asthi, Tvak, etc. We have to analyze there. Then, by doing a careful analysis of Samprapti of Vata Dosha dysfunction, by doing the careful analysis of Nidana of Vata Dosha dysfunction, if you are analyzing this, then we are going to say the person is suffering from the Vata dominant disease. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one tea that you'd like to hear in the coming days in this particular channel? Mentioned in the comment box below. And spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that YouTube algorithms will be fetching you the right information at the right time for the right purpose. Something more in the next video. Thank you.